This again is from chalkbeat.com. The Detroit School District is moving to remote instruction for 3 Fridays in December. A decision district officials attributed to concerns about mental health, COVID, and school cleanliness. I don't know if y'all know this or not, but COVID apparently does not affect people on Monday, Tuesday, Wednesday, and Thursday. You don't have to worry about COVID on Monday, Tuesday, Wednesday, and Thursday in Detroit. You can go to school and not worry about it. It's Friday. Oh my gosh, on Friday, COVID looks at his calendar and says, it's Friday, let's infect everybody. It's like at restaurants. At restaurants, there are a couple of restaurants in Atlanta still to this day where you're required to put on your mask to walk through the restaurant because COVID apparently hovers around 5.5 and higher. The moment you sit down, you're safe. You can take off your mask for the rest of the time you're there because COVID doesn't descend. It only floats high in the air. None of this makes sense. I saw a doctor on Twitter who said that he longed to be able to take his 3-year-old to the grocery store without putting her at risk of getting COVID. The data, the science, medical doctor, the science says your child is at no risk. Your child will be fine. People are living by fear. This is a failure. This is a failure in Detroit to do what they're doing. It is hijacking families, disrupting families. It is anti-science, and it comes on the heels of teacher union pressure in Detroit. There's going to be a voter backlash to this stuff. There will be a voter backlash. They don't seem to care. You know, we have not actually seen in this country massive spreading of COVID. Now, it has happened in high schools, but it hasn't been terrible. It hasn't been what they said. Here in Georgia, when schools reopened, many of them went without mask mandates, and there was not this massive wave of COVID coming through. And you never heard about that. Again, y'all, I'm convinced now that so much of the reporting on COVID is based on the PTSD of reporters who lived in New York and Los Angeles and saw hospitals filling up when it wasn't like that in most of the rest of the nation. Now, there were certainly parts of the nation. Albany, Georgia, can't discount that one. Per capita, Albany, Georgia was one of the hardest hit places in the nation, if not the world, and it's a smaller community in southern Georgia. And there was a funeral where a preacher preached he had COVID and spread it throughout the church community, who then spread it into the community. A lot of people died. And that city has gotten back up on its feet, and it's moved forward. There are a lot of reporters who do not want to move forward. And now we're learning about all the other fallout from COVID. This is from the Washington Post. Here's the headline. 100,000 Americans died of drug overdoses in 12 months during the pandemic. The U.S. drug epidemic reached another terrible milestone Wednesday when the government announced that more than 100,000 people had died of overdoses between April of 2020 and April of 2021. It is the first time that drug-related deaths have reached 6 figures in any 12-month period. The people who died, 275 every day, would fill the stadium where the University of Alabama plays football. Together, they equal the population of Roanoke, Virginia. The new data shows there are now more overdose deaths from the illegal synthetic opioid fentanyl than there were overdose deaths for all drugs in 2016. Despite the efforts of governments, healthcare providers, activists, and others, the problem is growing much worse. The new figures, which are provisional but rarely change much in final tallies, represent a 28.5% increase from the same period a year earlier. The financial, social, mental health, housing, and other difficulties of the COVID-19 pandemic are widely blamed for much of the increase. People predicted this would happen. We've talked about kids going to school in this country with their faces covered and what that would do. Remember that there was a whole bunch of data, the American Pediatric Society, on kids need facial recognition in order to learn. They need to see people's faces in order to learn emotion and to connect. And when the government came out and said kids needed to keep their masks on in school, The American Pediatric Association memory holds a lot of that data and say, oh, no, there's no research in this. They had it up on their website. I wish I were making that up. The willingness of progressives in this country, of the left, to cast aspersions on settled science if it doesn't meet their agenda is something someone someday needs to write about and document.